CEO of the American Diabetes Association, Chuck Henderson.
Good morning, everyone. Welcome to New Orleans. It is good to be back in person. I am honored to be the new CEO of the American Diabetes Association, the leading diabetes organization in the world. I stand before you today in honor of my grandmother, my uncle, who died of complications of diabetes, and to my mother, who spent a lifetime as a nursing professional. I've witnessed firsthand how diabetes can affect the family. This is personal to me, and I don't take this assignment lightly. Philanthropy and fundraising are part of my DNA. I spent over 24 years in the for-profit sector. I've been with the ADA for almost 3 years as the Chief Development Officer in the Office of the CEO. While here, we have secured nearly $200 million in donations and sponsorship for major partnerships with the launch of Health Equity Now, supporting our wonderful science and healthcare leadership team as they reignited our Pathways research program. Science and research are the foundation of this organization, and it was at this very meeting on June 1st, 1941, almost exactly to the day that the ADA was founded. 250 members attended the first conference in Cleveland, Ohio, and decided that the association would be a forum to an exchange of ideas, foster discussions, help solve problems, and promote the welfare of patients. And here we are, 82 years later, here in New Orleans in 2022. We have more than 10,000 people in attendance, virtually and in person. The vision and mission of the organization and this conference have not changed. This is my first in-person scientific sessions. I am excited and looking forward to learning new things over the next several days, from innovation and advances in technology for type 1 diabetes, remission of type 2 diabetes, impact on mental health, the continued effects on health inequities on people of color living with diabetes. The founders of the ADA were convinced they would change the course of medical history, and they did. And I am certain that with you, the world's greatest minds in diabetes research, we will continue the momentum to achieve our mission. I look forward to working with each and every one of you. And I would like to thank our board of directors, past and present, our volunteers, our partners, our sponsors and donors. And most importantly, thank you for your contributions, for being here in person and virtually. Thank you. And now, it is with great pleasure I introduce to some and present to others my esteemed colleague who have had the honor of serving alongside as part of the Office of the CEO and executive team, Dr. Robert DeBay, our Chief Medical and Scientific Officer of the American Diabetes Association.
Wow, Chuck, we're really excited for your leadership to take this organization to even greater heights. And I am thrilled to be here in person after 3 long years of virtual times. And so wonderful to see everybody. I am really excited to introduce the next speaker, our 2022 President for Healthcare and Education, Dr. Otis Kirksey. Dr. Kirksey is a distinguished pharmacist, professor emeritus, and a staunch advocate for people with diabetes. He has fought for health equity, particularly in the world of diabetes, has been a community force and leader around the African American community, and has had so much impact. I've had the pleasure of working with him, not only during his presidency, but during his time that he's served on the board, and he's been an important leader in helping us navigate the waters of the last 2 years. Here's what I know about Otis, is that he is someone who deeply cares and connects. Please join me in welcoming our 2022 President of Healthcare and Education, Dr. Otis Kirksey.
Thank you, Bob, for the introduction. Good morning, 88. I am deeply honored and deeply humbled for this opportunity to greet you as the American Diabetes Association's 2022 President of Healthcare and Education. It has been such a pleasure to serve the Board of Directors for the past 3 years. The opportunity to work with such a dynamic group of people is certainly a key milestone in my professional journey. Before I get started, I'd like to disclose that I am a speaker for Novo Nordisk. I'm getting that out of the way. Ken Costa, the author of Know Your Why, Your Purpose and Your Motivation with Your Now, said, your why gives you a competing advantage, because if you are operating from why, you're usually working with great passion and focus. He goes on to point out that our why has extraordinary ramifications for our work. It impacts our concentration, our drive, our usefulness. So I ask each of you today, do you know your why? I discovered my why several years ago. What is my why? Why am I here? This place, this moment. My arrival here, this place, this time, for this reason, is shaped by the many people, my village, who play such an extraordinary role in my life, my social life, my personal life, and my professional life. I'm here because of my mother, Constance Kirksey, an educator in the Volusia County Schools for almost 40 years. She created my thirst for learning and planted the seed of passion for teaching and student advocacy. I'm here because of my father, Sammy Kirksey Sr., who did finish high school, was a common laborer who never met a stranger. Taught me to meet people where they are and that everyone mattered. I'm here because of Unc, Eddie Robinson, my mother's oldest brother, who was a big man with a big personality, taught me confidence and placed a constant theme in me that there's nothing that I could not achieve if I worked hard. His favorite line was, I'm fat, but I'm pretty. Little did he know how impactful that statement and attitude would be in the development of my personal self-confidence. I'm here because of Uncle Kenny, Kenneth Brown, my mom's youngest brother, who as a 6'+ 300-pound gay man is still in me the importance of family. He established high expectations for me and accepted no excuses for failure. See, my family taught me the importance of equity and the recognition that diversity is powerful and necessary. I'm here because of Florida A&M University, a historically Black college and university founded in 1887. FAMU provided me with a strong academic and professional foundation that I continue to build on even now. During my tenure as a pharmacy student at FAMU, I became keenly aware of the gross health disparities and inequities that influence the poor health outcomes of marginalized communities. As a result, I left FAMU with an obligation and an appreciation for community outreach and engagement. I was honored to return to FAMU years after graduation to serve on the faculty of the College of Pharmacy and Pharmaceutical Sciences at Institute of Public Health. For more than 25 years and unbelievable 2 generations of students, I had the pleasure of paying it forward, teaching and training future pharmacists to become compassionate pharmacy practitioners. It was also during this time that I developed a deep sense of commitment and passion and caring for people living with diabetes. It became personal. It became my mission. I'm here because the Neighborhood Medical Center, a federally qualified community health center that serves as a medical safety net for thousands of uninsured and uninsured people living in Tallahassee and surrounding communities. The center has 5 locations throughout Leon and Gaston County in Florida. Neighborhood was my clinical training site for the many students that I trained in Florida A&M. For more than 20 years, I have been embedded in the practice as a clinical pharmacist, providing diabetes education and disease management. It was only possible because of the center's administration's forward thinking, and they have an appreciation for the expanded role of a pharmacist in this environment. The special nature of our center describes us as being relatable, accessible, and a trusted community resource. We are an authentic part of our community. We provide comprehensive primary care services that include chronic disease management, mental health, dental care, and our specialty services include OBGYN, orthopedics, and psychiatry. And finally, the glue that holds it all together, case management services, which is so critical for the patient population we serve. Telehealth services for primary care, mental health, and case management. To a limited extent, pediatric care was implemented during COVID as a result of the COVID pandemic. In fact, we still continue to provide a lot of those services via telehealth. Our goal at Neighborhood mirrors that of Helping People 2020, social determinants of health, to identify ways to create social and physical environments that promote good health for all. The Helping People 2020 approach is based on 5 key areas of social determinants of health: economic stability, education, social and community context, health and healthcare, neighborhood and built environments. Many of our patients struggle daily to cover the cost of medications and testing supplies, even those with insurance, Medicaid and Medicare. High co-pays often impede access. Many of our patients have food insecurity. In addition to the high cost of eating healthy, there's also the problem of food access. The service areas of neighborhood include several neighborhoods that have been identified as food deserts. So the balance of high food costs, medications, and other necessities of life are a constant challenge that our patients face on a daily basis. Our patient population ranges from infants to seniors, and while our population is diverse, it is mainly comprised of African Americans, A large percentage of these patients we serve fall below the 200% of the federal poverty level. Most of our patients are uninsured and live in public housing. In 2020, the percentages of neighborhood medical centers patient population with diabetes and hypertension was almost 18% and 22% respectively. Now, while the rate of diabetes was much higher than the US rate of 11.3%, the rate of hypertension was significantly lower than the national rate of 47%. Our diabetes education and management program is a multidisciplinary team consisting of a certified diabetes education and care specialist, physician providers, nurse practitioners, mental health and case counselors, and medical assistants. Our team-based approach follows the recommendations from the ADA Standard of Medical Care in Diabetes, which is to align approaches to diabetes management with the chronic care model. This model emphasizes person-centered, integrated long-care treatment approaches to diabetes and its comorbidities, and ongoing collaborative communication and goal setting between all team members. Collaborative multidisciplinary teams are the best suited to provide people with chronic disease conditions such as diabetes and to facilitate patient self-management. Utilization of this model has been essential to help us improve our patients' diabetes care. Our program incorporates disease management for both type 1 and type 2 diabetes, hypertension, and hyperlipidemia. The services are evidence-based, primary one-on-one encounters. A retrospective review of charts to kind of get an idea of what our patient profiles look like. We found that at the baseline, the average A1Cs by patients coming into the program was 9.6. 50% of our patients had A1Cs greater than 9. And when we did a 3 to 6 month follow-up looking at progress, we found that we had about 1.83% A1C reduction, which is not bad. While we face significant challenges daily, our patients are extremely satisfied with the services that we provide. We're all excited about how far we have come in an effort to improve care for people living with diabetes. However, we must also understand that there is an enormous workload that we still face. Unfortunately, the success and progress that have not been improved in outcome. The success and progress have not resulted in improved outcomes for a large percentage of people living with diabetes, primarily those people living in marginalized communities. The perpetual health inequities and unconscious bias experienced by communities of color have fueled an inferno of health disparities that are characterized by high rates of hospitalizations due to uncontrolled diabetes, higher rates of lower extreme amputations, and high mortality rates. It is critical that we embrace the reality that these health disparities exist, as well as the factors that contribute to and promote the health inequities that fuel their existence. We must engage with our communities to keep lines of communication open and help them understand that we are here to help. I am so proud of the response to the gross disproportionate impact of COVID-19 pandemic on the people living with diabetes by the American Diabetes Association. It launched its Health Equity Now campaign and Bill of Rights. This campaign was built on a vision of a future without health disparities. Can you Imagine that. The campaign is built on a foundation of acknowledgement of the social determinants of health that influence health inequities. So in response to the rapid increase in the cost of life-saving insulin, the ADA has exhaustively advocated for affordable insulin prices throughout this country. And as a result, we now have 20 states, soon to be 21, including the District of Columbia, have affordable insulin laws in place. So in November 2021, as part of the President's Build Back Better Act, the U.S. House of Representatives passed the most sweeping nationwide measure to date to limit out-of-pocket costs for insulin. Hopefully, this groundbreaking legislation will end the deadly and consequent practice of rationing insulin supply. Early this year, the ADA launched its Burdens of Diabetes campaign. In 2004, the federal government cleared the way for charitable organizations to help fill the gap in patient care through financial assistance. You may know this as patient assistance programs, and utilize them to help support patients in need. Until this year, there wasn't a program that focused on helping people with diabetes. The American Diabetes Association changed this through the Patient Advocate Foundation, sometimes known as copay.org. The fund opened in January 26th of this year, with all the funds being dispersed in 13 days. I think that explains the need that's out there. Funds approved for use were approved for use for copays, tests, supplies, medications, and they were dispersed on a first come, first served basis once the applications were approved. We continue to fundraise and seek the financial support to reopen the fund. The experts at the Patient Advocate Foundation estimate that currently 13 million people with diabetes will qualify for financial assistance, which is why we need to continue to support this fund. Please share with your colleagues both the presence of this fund and the need for continued dollars to reopen it for those who qualify. So those are the three important reasons that I'm proud to be involved with the ADA. The ADA's Health Equity Bill of Rights envisions a future without health disparities. It ensures 133 million Americans living with diabetes and prediabetes, along with the millions more who are at risk for diabetes, no matter their race, their income, their zip code, age, education, or gender, given equal access to the most basic of human rights, their health. Health equity now, insulin portability, the diabetes burden campaign provide us with an exceptional start. However, there's much more to be done. Allow me to share two call to action points that a person would need. Number one, I think we must urgently develop strategies to increase and diversify the overall number of diabetes care and education specialists in order to meet the growing need. I'm extremely concerned about the lack of access to diabetes education by people living with diabetes. Diabetes self-management education and training is an essential component of the overall diabetes care plan, and it has been proven to improve diabetes outcomes. However, the number of diabetes care and education specialists is insufficient. In 2020, the National Certification Board reported that there were 19,783 certified diabetes care education specialists. An additional 15,000 were uncredentialed in the United States. So that translates to one educator for every 16,000 patients. Even more alarming is the poor representation of communities of color among the current diabetes care and education workforce. According to career site Zipia.com, only 8.7% of diabetes care education specialists are Black. Yet African Americans are 2 times as likely to be diagnosed with the disease, and they suffer a disproportionate share of the morbidity and mortality associated with diabetes. Number 2, I think we should increase the role of pharmacists in the effort to bend the curve on diabetes. As a practicing pharmacist currently providing diabetes education and management, I'm personally aware of the critical role pharmacists can play. And multiple studies have demonstrated the effectiveness of pharmacists improving diabetes outcome. Despite their proven effectiveness, pharmacists are underutilized and are still limited in their scope of practice because they lack provider status and therefore face reimbursement challenges. This should change. That's my short list. Have you developed yours? Any effort to bend the curve of diabetes will require an all-hands-on-deck approach. Collectively, I know we can improve the lives of people living with diabetes and reduce the associated morbidity and mortality. As I close, I would like to thank each of you for all that you do in this effort, as well as your support for the American Diabetes Association and its initiatives. Finally, I must acknowledge my village. Joining me today, my dear friends, Dr. Maurice Holder, my major professor, and his guest, Betty Grable. They are here in spirit. They had conflict and were not able to actually be here present. And Dr. Donna Palm and his wife, Nikisha. Don predicted that this day would come. Don, thanks for your encouragement and your support. I'd like to also thank my 2 fraternity brothers and their wives, Herbert and Kelly Bailey, and Ricardo and Jeannie Banks. And some special friends right here in New Orleans, Larry and Ann Legault, for coming out and supporting me. I have many other family and friends that are watching this on me virtually. And I really want to thank them for their support. Most importantly, I'd like to thank my lovely wife, Karen. She is my biggest cheerleader and truly the wind beneath my wings. She's pictured here with our 2 daughters, Alex and Amanda. Karen, thank you for your unending love, your patience, and friendship. So I'd like to leave you with a quote that I use very often with my students. People, or in this case, patients, don't care how much you know until they know how much you care. Thank you, ADA. Enjoy the rest of the session. Thank you. So now it is my pleasure to introduce to you one of my colleagues and friends. Her passion for diabetes, passion for people with diabetes is infectious, and her commitment to the field of education is inspiring. She co-authored the 2015 and 2020 consensus reports for diabetes self-management, education, and support in type 2 diabetes, 2017 national standards of Diabetes Self-Management and Education and Support, and the first ADA EASD consensus report for type 1 diabetes for 2021. Our 2022 Outstanding Diabetes Educator is Amy Hatch Fisher. Amy is recipient Amy is the recipient of the Outstanding Educator in Diabetes Award. This award recognizes a distinguished healthcare professional who has made outstanding educational efforts in the field of diabetes. She's currently the quality coordinator for the American Diabetes Association's Education Recognition Program at the University of Chicago. She has been an advanced practice dietitian, diabetes care and education specialist, and technology trainer for over 20 years. She has served as co-chair of the 2022 National Standards of Diabetes Self-Management and Training and Support. She also is current chair of the American Diabetes Association's National Recognition Program. She's an international speaker and has authored numerous publications in the area of diabetes care and education. And professional activities include writing into the continuing education test, questions for the Association of Diabetes Care and Education Specialists, and reviewing manuscript submissions for the Academy of Nutrition and Dietetics. So please join me in celebrating Amy Hatch Fisher for outstanding contributions in diabetes care and education.